Ever noticed changes in the amount of semen you produce? For some, it might be a lot more than usual. If you've ever wondered why that happens or if it could mean something more, you're not alone. Hyperspermia is a condition where the body produces an above-average volume of semen. While it may seem harmless, it can sometimes affect your fertility. Let's dig deeper into what this condition really is, what might cause it, and what it could mean for your health and future family plans. What is hyperspermia? To break it down simply, hyperspermia means having a higher than average volume of semen per ejaculation. Typically, anything over 5.5 to 6 milliliters per ejaculation falls into the hyperspermia category. So, what exactly is semen? It's a fluid carrying sperm from the testes, along with other fluids from the prostate and seminal vesicles, which fuel the sperm on their journey to fertilize an egg. Interestingly, though the name might imply that hyperspermia involves an increase in sperm, that's not always the case. Often, it's just the other fluids that have increased, making it feel like a lot more. One study found that people with hyperspermia actually had normal sperm levels, with the extra volume mostly coming from prostate and seminal fluids. What causes hyperspermia? Now, you may wonder, what causes this condition? The exact cause is a bit of a mystery. Some researchers believe it could be linked to lifestyle habits, like taking certain supplements or herbs. There's also a theory that a low-grade infection or inflammation in the prostate might boost fluid production, but there's still no solid evidence. Temporary hyperspermia can occur after a period of sexual abstinence, with semen production returning to normal soon after. However, if hyperspermia persists, it could be worth exploring whether there's an underlying cause, even if it's relatively harmless. Symptoms of hyperspermia. How do you know if you have hyperspermia? The main sign is pretty straightforward: you produce more semen than average. But without a reference point, you might not even realize it's happening. There are no physical symptoms that set hyperspermia apart, so some people may have it without ever noticing. In most cases, hyperspermia doesn't cause any pain or other health issues, and it often goes undetected unless fertility becomes a concern. If you do notice a significant change in volume, though, it may be worth a quick check-in with your doctor. Does hyperspermia affect fertility? One common question is whether hyperspermia can affect fertility. The answer: sometimes, yes. Hyperspermia can lead to a lower concentration of sperm per milliliter because the other fluids dilute the amount of sperm. That lower concentration may make it harder for sperm to reach and fertilize an egg. However, it doesn't automatically lead to infertility. Many people with hyperspermia still have healthy sperm levels and no issues with fertility. But if you're trying to conceive and suspect hyperspermia might be a factor, getting a semen analysis could provide some valuable insights. You'll get a clear picture of both sperm count and quality, which can help guide any necessary next steps. Treatment options for hyperspermia. What if hyperspermia does impact your fertility? Are there treatments available? 1. Medication. Doctors sometimes prescribe medications that can help boost sperm count, particularly if low sperm concentration is an issue. For example, clomiphene citrate, Clomid, is a medication that stimulates hormone production and can potentially increase sperm production. Although Clomid is not specifically approved for male fertility, it has shown some promising results for some people. 2. Assisted reproductive therapy, ART. For those who are actively trying to conceive, ART can be another option. This includes procedures like in vitro fertilization, IVF, and intracytoplasmic sperm injection, ICSI. These techniques involve mixing sperm and eggs outside the body to facilitate fertilization. ART can be incredibly helpful for couples facing challenges due to hyperspermia or other fertility issues. In fact, ART accounts for the conception of nearly 2% of infants born in the United States, according to the CDC. When to see a doctor. If you're experiencing consistent hyperspermia and have concerns about your fertility, it's wise to see a doctor. The evaluation process usually involves a physical examination and some specific tests. Semen analysis. A semen analysis is essential for assessing sperm count, concentration, and quality. This test will give you a clear understanding of whether hyperspermia is impacting your fertility. Blood tests. Blood work can help identify other factors that may affect fertility, such as hormonal imbalances or low testosterone levels. Imaging tests. Sometimes, doctors may use imaging tests, like ultrasounds, to check for issues in the reproductive system. This can help detect any abnormalities in the prostate or seminal vesicles that may contribute to hyperspermia. Living with hyperspermia. So, what's the takeaway? Hyperspermia is rare, often harmless, and usually doesn't affect your overall health. However, it may influence fertility for some individuals. If that's a concern for you, there are options available, from medication to advanced reproductive therapies. With the right medical support, most people with hyperspermia who want to start a family can still achieve their goals. Hyperspermia might be a unique part of your life, but it doesn't have to define it. The key is staying informed, seeking guidance, and exploring solutions if needed. And remember, it's always okay to reach out to a doctor if you have questions or concerns. Your reproductive health matters, and understanding conditions like hyperspermia is an important step in taking control of it.